Greetings, I'm Dr. Neha Gupta, infectious diseases physician from the first batch of qualified infectious diseases specialists in India. And today I'm just going to describe a few latest updates regarding the isolation of COVID-19. So, as per the latest data from the CDC, based on the knowledge which is now becoming more and more obvious, that for patients with COVID-19 and with the Omicron variant, the isolation duration has been shortened. So earlier we would isolate for close to 10 days, but now patients are to be isolated for 5 days, followed by they need to have a strict wearing the mask is very important, and it should be a well fitted mask. So the isolation duration has been shortened to just 5 days, which is in fact a good news. The premise for this particular change is that the maximum transmission of COVID-19 happens 1 to 2 days before the onset of symptoms, and then it occurs 2 to 3 days after the onset of symptoms. So that is why the risk of transmission gets reduced when a patient is isolated for 5 days and subsequently wearing a mask for another 5 days at least, which should be a well-fitted mask. And in today's scenario, anyways, the mask has to be continued for prevention of other infections as well, and prevention of COVID-19. So that's one. And second is, like, in case there is a person who gets exposed to somebody who's COVID-19, then how long they should be quarantined. So again, the duration has been shortened to just 5 days. So quarantine period now is just 5 days, followed by again wearing of a well-fitted mask, which will definitely reduce the chances of infection, as well as it will reduce the chances of further transmission into the community. And it's whatever updates we have so far, yes, Omicron variant is definitely a variant which is very contagious, and it is going to result in in a higher peak and probably a shorter peak, because it's so contagious and very fast spreading as compared to the Delta variant. But most of the cases have been mild, have resulted in less hospitalization as well as lesser mortality. Thank you so much.